All right, so moving through chapter 21, which is the poisoning. Um, poisonings and overdose emergencies. Um, we can see this quite a bit. I've actually, in Ch County, I've had a lot of poisoning, um, different kinds of calls, and anyway, so a lot of calls on different drinks of antifreeze and um, bleach and other kind of stuff. So you will see this quite a bit. So alcohol and substance abuse is part of it. That would be part of the chapter, and then poisoning. So poisoning is anything that harms the body, any substance that harms the body, the harm it can cause as a result of a medical emergency. So anything that is not supposed to be in the body or on the body can harm the body. So it's classified as a poison. Some common ones are medications, petroleum products, cosmetics, pesticides, plants, food. I know of a kid that ate a bunch of decon that someone put in their house. Anything that's in the house that, or in your workplace, or even at the ambulance station, anything that could harm the internal inside the body and outside the body, it's not supposed to be there, can harm it. So effects a poison can have, it's based on of nature of poison. Its concentration, route of entry, patient's age, weight, and health. So all those things are in factors. So when you get paged out, for a poisoning or a anything of that nature, everything's going to be everything you want to base it on is what kind of concentration was it, the nature of the poison, the route that it was of entry, which we'll get to in a minute in the chapter, and also the age and weight of the patient, plus how healthy they are. If there's someone that's already got cancer and they're on radiation and then they got poisoned, their immune system's shot, so a lot of all that stuff is going to matter. It's going to cause some damage to skin and tissue from contact, possible suffocation, localized or systemic damage to body systems. Um, so the routes here is that ingested, which is swallowed, um, anything that decon, anything you could drink, inhaled when we breathe it in. So any kind of chemical that can be inhaled, it's turned into the air. I actually in Lyman, Lincoln County, there was a page for someone who was lifeguard putting chlorine in the pool, and the bag somehow exploded. Somehow it like popped open, and she inhaled a bunch of that chlorine. So breathed in, even though it was a powder, it went into the air, and she inhaled it, and there you go. Absorbed through unbroken skin, injected, inserted through skin. So EMTs, so just a pediatric note is EMTs own home and squad building should be childproof. You want to go through your house if you have a kid, um, or your workplace, and just make sure everything's childproof from these things. That kid that ate a bunch of decon survived, but um, wasn't very pleasant for the child or the parents. Uh, when we go to schools, you will be asked as EMTs to do special events like schools and Girl Scouts, Boy Scouts, all that. It's a good time to talk about information and prevention, so we don't see this stuff with everybody. The poisons, so there you go, is a picture of it in your book. Inhalations, which is sprays and cleaning fluid. Injections is drugs, a lot of drugs use. Ingestion could be the rat poison, drain cleaner, anything in your house that can be drunk, really bleach. Um, absorption is household cleaners as well, and insecticides. So, when I look at those things, especially people don't think about it when you order. You have an exterminator come through your house that kill all the bugs around, but all that stuff's in your house now too. And I'm just not a big fan of all that kind of stuff. I like to get rid of bugs, but I think we sometimes are naive to what damage we can actually cause. Um, Ingestive poison. So a child may accidentally eat or drink a toxic substance, like we said, get around the house, get around the car, get around the garage, and accidentally inhale something that is toxic. And for adults, it's mainly not accidental. A lot of times with adults, it's either an accidental, whether a lot of elderly people will not think about their medications, forget they took it that day and take it again, and so accidental or deliberate overdose. Patients assessment. So when we go on scene to these things, what are we going to do? So we want to know what substance was involved. Look for container. Check the labels of that container to learn more about it. Transport with patient to hospital. So a lot of these overdoses, not a whole lot we can do. We're going to get to some things that we can do. But even with that chlorine call in Lincoln County. I looked at labels. We checked everything out, or my partner looked at labels, and we got a hold of poison control, and just got some recommendations of what we should do, and you can do that as well. We want to know when the exposure occurred. Again, the history, like how long, what was the events leading up to it, how long ago did it happen. Quick acting poison requires faster treatment. So when you find out what kind of, if it's a slow reacting or quick reacting, that changes how you got to treat. An ER personnel need to know immediately for appropriate testing and treatment. So do not hesitate to get in touch with KMH to get them up to speed on what's going on so they can activate their team as well and speed up the process. Want to know how much was ingested? Estimate missing pills by looking at the prescription label. A lot of times you get on calls, you got to have, hopefully there's family around too. So do you know when they took this medication? Was this bottle full today? If it's empty, you know that they took all of it. So but you kind of guess how much was, if it's an accidental overdose, chances are it's not the whole bottle missing, but kind of guesstimate how much is missing according to history. And then also you can look at the prescription bottle and see, okay, it was filled on this day, and take one a day, and there's these many missing, so oh man, he took 5 too many today, because the days don't add up. If the bottle is empty, try to find out from him or her or the family, was this full today? How much did it? Just kind of guesstimate and look around. Over how long a time did the ingestion occur? Like I said, for some treatments, if the drug's fast acting, we got to get moving. So how long has it been in the system, and what medication's taken for very first time, and was medication taken chronically? So have they taken it for a long time, or is this a new drug to their body? What interventions have been taken? So treatments indicated on label. Other home remedies is syrup of Ipecac, and so syrup of Ipecac will cause vomiting and try to get that stuff out of their system. So was there any interventions taking place already before we got there? And what is the patient's estimated weight? Find that out. Rate of onset of toxic effects is related to how much the patient weighs, on the body. So the more the patient weighs, might slow down the process. How fast is their metabolism? How slow is their metabolism? All those kind of things. What effects has patient experienced? Nausea, vomiting, altered mental status, diarrhea, chemical burns around the mouth, an unusual breath odor. What kind of things are you seeing for signs and symptoms, and what's been going on? Mental status, abdominal pain, and with your assessment, you just kind of got to see, okay, here's the baseline of this patient's health. Now these are things they're experiencing from the drugs, and kind of got to gauge with what you're seeing, with how fast it's reacting, and kind of intervene on that situation as much as we can. Some food poisoning can be caused by improperly handled or prepared food. So we all know that, right? So undercooked chicken, undercooked fish. So some symptoms that will come with that is nausea, vomiting, abdominal cramps, diarrhea, and fever. I mean, food poisoning is horrible. I've never had it myself, but I hear it's ridiculous. So it may occur within hours of ingestion or a day or two later. And I'll be honest with you, my thing of what I've seen most with food poisoning, that's within about an hour and a half of eating the food. If it's a day or two later, there's something else in my mind going on. It should be out of your system by that point, but follow the book for tests, but that's just my personal opinion. Activated charcoal works through absorption, so allowing substance to attach to its surface. So when you give activated charcoal, and we can do this in the field or in the ambulance, when you give activated charcoal, it allows the toxins to attach to the charcoal and prevents it from absorbing into the body. So it's not an antidote, and there's going to be a difference that we're going to learn in this chapter between antidotes and treatments, but it will help prevent it from absorbing more in the body. So like it says right here in your book, prevents or reduces the amount of poison absorbed. So many poisons, but not all, are absorbed by activated charcoal. Medical direction will determine whether the use of this substance is appropriate. So when we call in, we're saying we're going to give charcoal, it's always good to give feedback of if it's a good thing or not a good thing for that patient at that time. Another thing about activated charcoal versus syrup of Ipecac. Traditionally, syrup of ipecac was preferred treatment for poisoning, so it induces vomiting in most people with one dose. It's a horrible deal. However, it has potential to make patients aspirate. It only removes less than 1/3 of the stomach contents. So, um, not a big fan of it. It's a horrible thing. Um, I like activated charcoal versus that, and it also says that in your book, I believe, if you read through it. But it doesn't fully get rid of everything, and it induces vomiting so fast, and they can aspirate to get in the lungs, and it's just not a pleasant experience. So dilution, adult patients should drink 1 or 2 glasses of water or milk to dilute the poison. Children should drink 1/2 to 1 full glass of water or milk. Water may slow the absorption, but milk may soothe stomach upset. So um, judgment call on those ones. Follow your book for test. I mean, for me, for example, I'm intolerant to milk, so what good would that do? And if you don't know that about the patient, what good will that do? So, um, I don't know, hit or miss on that one, but anything that you can do to soothe that stomach. So if you can give milk and that does calm the stomach down, fantastic. May slow the absorption down with the water because it'll dilute the poison. Um, anyway, so frequently advised for patients who is determined by medical direction do not need transport. So this is also a case where this is an emergency. They obviously drank something they shouldn't. They ingested something they shouldn't, but they don't require transport. So you're giving them advice at home to give milk, or you watch them drink the milk, see if that helps. Um, but also, again, if you have any kind of poison, follow protocols, get a hold of medical direction, and use your judgment on those things. But those are just some remedies if you're not going to transport the patient. Now, antidotes is thought of a substance that will neutralize the poison for its effects. Very few genuine antidotes exist. I have not heard of very many at all, but naloxone directly reverses narcotics. And naloxone is Narcan. We do carry that. So if a narcotic it's a depressed effects on level of consciousness and respiratory drive. So narcotics, depressant, right? So it knocks your respiratory rate down, your consciousness. So a lot of times when you show up to these calls, the patient's already unconscious or about ready to go unconscious. And narcotics, uh, the reverse effect is Narcan, naloxone, and that will help. A couple sprays of that, and plus there's an IV that we give through IV, and it will reverse the effects and bring the patient back alert. You'll see these effects quickly. If it's Narcan, if you go into a patient and they're unconscious and you give Narcan, and it's truly a narcotic episode, you'll see the effects of the response of the patient come around quickly, and you'll know that's the problem. Um, so first, take standard precautions. 1. Quickly gather information. When a patient has ingested a poison, it provides another reason to avoid mouth-to-mouth contact. Provide ventilations through a pocket face mask or other barrier device um, when they're unconscious. Call medical direction on the scene or en route to the hospital just to get some little bit of advisement. Always cover your butt with medical direction. I never really do, but not always the smartest thing either. But I will on a poison thing because there's not very many of them around here in our county. Um, for those, I will check with medical direction before making a full decision on how to treat. If directed, administer activated charcoal. You may wish to administer the medication in a cup that has a lid or a hole or straw, to help them get it in there. It can get pretty messy. And then travel safe. So think about your own home. Is it safe? Are there potential poisons within 3 feet of the floor or behind unlocked doors? Are there household cleaners that look like juices and drinks familiar to children? So think about that. Can flavored children's medication be mistaken for candy? In what sense does a small child typically use to identify things? The fact is, if it looks like, oh, that looks like candy, kids are going to probably drink it. Um, so just always look around your house, make sure it's safe, look at your situation. So when it comes to inhaled poisons, common types is carbon monoxide, ammonia, chlorine gas, agriculture chemicals and pesticides, carbon dioxide. All that is inhaled. So when it's an inhaled thing, first scene safety. Make sure, is the house safe? Is it carbon monoxide? What's going on? Approach the scene with caution. Protective clothing and self-contained breathing apparatus may be required, which is, firemen carry those things. Um, if not trained or equipped, call for additional resources. So for those of you who are not firemen on the department, or it doesn't matter really, for EMS showing up without fire to a situation like this, you know, en route, get fire on en route, page them out and get them to help support the situation because they carry the proper equipment and they're more trained with um, those kind of gases and things that could be dangerous to you. Plus, they got all the all the apparatuses to properly protect themselves. Go in and get the patient and bring them out to us. You don't always have to go in. Um, so just think about those things when you're showing up to those deals. So if it's carbon monoxide, ammonia, chlorine gas, agriculture chemicals and pesticides, carbon dioxide, all that kind of stuff is unsafe. If it's unsafe for the patient, it's unsafe for you. So we take proper safety and precautions and get fire to help us page them out. So inhaled poisons, signs and symptoms, difficulty breathing, obviously, especially with, like we had that anhydrous leak a while back. That's going to definitely shut down the respiratory system. But a lot of these things will give difficulty breathing, chest pain to go along with it, coughing, the dizziness, hoarseness of breath or hoarseness of voice, headache, confusion, altered mental status, can cause seizures. Those are things we need to train more on out here because if there's something that's in the air, we're going to have multiple patients. And if it's a house full of people and they have a carbon monoxide leak, all that's going to, or carbon monoxide, all that kind of stuff that can leak in the house, it can be a scary deal. So, what substance was involved? Get the exact name before you even get on scene if you can. When dispatch pages it out and they don't give you a name, try to get that name from them. When did the exposure occur? When you get on scene now you're assessing how long has this leak been going on? How long have they been ingesting this gas? Over how long did exposure occur? What interventions has anyone taken? Did someone remove the patient? Did someone ventilate the area? What effects is patient experiencing? So, it's like any other assessment, but now you got to be more thorough with a couple things. You want to know how long they've been ingesting that poison, how long the exposure has been taking place, and what has been done. Before did a deputy go in and pull the patient out? Did a family member pull the patient out? Was the patient in the garage and their car was running? And did they get them out? Find out the things of all those kind of materials that or all that information you can gather, and then find out what are they experiencing. Are they experiencing these treatments we just read? Are they having difficulty breathing? Are they? Because if they are having, the thing about this is maybe they don't even feel like they're having difficulty breathing, but they have a hoarseness in their voice and they're coughing. Well, there's going to be respiratory issues. If they have a headache, they're on their way to a seizure potentially, or getting ready to be altered in their mental status. So get as much information as you can get on what they're experiencing and how long they've been exposed and how long have they been experiencing it. So just kind of common sense on those things. Patient care, move patient from an unsafe environment using trained and equipped personnel. So one, get the firemen involved, but also remember your training from chapter 1 or 2. I can't remember, one of those 2 chapters where about lifting and moving patients. Detect and treat immediately life-threatening problems in primary assessment. So again, you're going through your assessment, you're finding those life threats, you're treating those life threats, but the first thing before that is you're getting them to a safe place. So if they're still in the environment that they were in when they started feeling these things, get them out of there, then start your assessment, and then start your life-threatening treatment, or treating for those life threats, and then continue on with your assessment. And get those vital signs so you know where they're at. Because you got to realize too, these gases and sometimes these things that people are being exposed to, you're not going to see them. All you know is, hey, there's someone with an altered mental status, and they're coughing. I'm getting them out. I'm start my assessment. I'm taking care of the life threats with the respiratory issues or whatever else they're experiencing, and then I'm going to get the vital signs after I know they're stable, and see where their baseline is, so I can follow the trends to see where we're at. Patient care. Administer high concentration of oxygen. Definitely want to get that going. 15 liters on non-rebreather. Transport with all containers, bottles, and labels of whatever they've been exposed to. Perform reassessment en route. So right there, you got 3 assessments done before you get to the hospital, right? 1, you get them out of their environment. Primary assessment, treat those life threats. Boom, now you're doing your secondary assessment with vital signs. and then you're grabbing all the exposure that you can, anything that shows what they were exposed to, and taking it with you, and you're getting your third assessment while you're en route. And then you're also, while you're doing your third assessment, get a hold of KMH and let them know what you got coming and that you what they've been exposed to if you can. Carbon monoxide, it's colorless, odorless, tasteless gases and created by combustion. So they can be caused by improper venting um, of fireplaces, portable heaters, generators. Common cause of death during winter and power outages. So it's a scary deal. Um, you don't see it, you can't taste it. I mean, you can't smell it. It's just a horrible thing because it's in the house, um, and it can really cause a lot of problems. I knew a guy one time who couldn't get a hold of his dad for a good while, and went over to the house, and he had a carbon monoxide leak, and he was about dead when he got there. He was able to save him and get help on the way, but the point is, this guy was just in his bed sleeping, didn't realize what was going on, and boom, here we are. There's another story I heard about. You can actually look it up on YouTube. Um, there's a detective that works in Colorado Springs, and they made a show about this situation because he went on this call, and there was 5 people dead in the house, and it looked like murder, right? It looked like it looked like one girl was probably raped, um, and but they're all dead in the house. Well, over time, that detective, while he was in the house, started to realize he started getting a headache. So he cleared everybody out of the house, found out it was a carbon monoxide leak, killed the 4 kids and the babysitter. And the reason that she felt it looked like rape is the babysitter was getting sick, so she unbuttoned her pants because she was getting distended, um, and so it looked like there's foul play there, but really it was a carbon monoxide leak that killed 4 kids and the babysitter. Um, Again, colorless, odorless, tasteless, and it's a scary deal. Carbon monoxide signs are headaches, especially a band around the head, a band around the head, so it feels like your head's being squeezed by a vice, kind of like what your chest would feel like if you're having a heart attack. Dizziness, difficulty breathing, nausea, cyanosis because you're going hypoxic, and your altered mental status. In severe cases, they're unconscious or they die. Um, and the fact is, no matter if they're exposed to this for a long period of time, and they just got a headache and they don't know why they got a headache, they don't know what's going on. Like that house full of kids and a babysitter, they didn't know what was happening. Um, but eventually went unconscious, and then it was too late to save themselves, and they died. So unconsciousness is definitely a last sign, and it's a bad deal. But just remember, when you go on a scene and you can't see anything, you can't smell anything, but they have a headache and they're dizzy, carbon monoxide. Think about that. They, um, Special monitors are needed to detect the presence of carbon monoxide in the environment. So firemen carry them. Get them if you got show up to a scene for a sick person, right, in the middle of winter, and man, I have a headache, and they're dizzy, and you're suspecting carbon monoxide. Get the fire department over there to help test the house and get that patient out of the house. Treatment: the patient may be beginning to feel shortly after being removed from the dangerous environment. Um, I think that must mean the patient may begin to feel better shortly after being removed from the dangerous environment. Point being is you administer 100% oxygen, down a breather, 15 liters. The reason they feel better out of that environment is they're breathing in fresh air, and now they're able to get that carbon dioxide breathing out of their system and detox and transport them to the hospital. It takes time to wash out CO from the bloodstream, so it'll take some time and get them to the proper facilities. Um, Smoke from burning materials can contain poisonous and toxic substances. Um, so ammonia, chlorine, cyanide, all that kind of good stuff. And it can irritate the skin, eyes, damage lungs, and progress to respiratory or cardiac arrest. Um, all that's poison in the body. I know people in other countries that burn tires for fire, or for they can't afford wood, so they burn rubber, find around and burn it in their house. But obviously they have short lifespan. This is a whole culture that does this, so they die at young ages because they're breathing all that poison, from those rubbers, and it'll cause cardiac arrest. Um, Difficulty breathing is a sign and symptom. Coughing, smoky or chemical smell on breath, black carbon residue in the mouth, nose, or sputum, sign nasal or facial hair, or singed. I'm sorry, singed nasal or facial hair. But the thing is, when you go on a smoke inhalation, you're going to know what that call is. I mean, it's pretty obvious. It's not like smoke is odorless or tasteless or colorless. You're going to know what it is. But when you look at the symptoms that they got going on, you'll determine, did they could they potentially burn the inside of their airway, the bronchial tubes, and all that kind of stuff. Because if you breathe in smoke or you're burning that stuff, it can burn all the way down. So when you have black residue on the mouth and nose, that's a bad day, potentially. Um, Treatment is move the patient to a safe area, assess the patient, maintain that airway. It's a life threat, provide high concentration of oxygen, 15 liters on non-rebreather, monitor patient closely. Airway burns may lead to swelling of airway, so then you got respiratory distress. Um, so you want to, depend on the condition of the patient, how bad they're burned. You'll know if that airway is closing up, right? Because you're going to hear it, and then you got to take quick interventions to keep that airway open. Preferably, get ALS moving your way, and probably gonna have the RSI, which is rapid sequence intubation, and intubate the patients to keep that airway open, pending how bad that is. If it, so you'll know that when you get on scene. But move them to a safe area, assess the patient, maintain that airway, provide high concentration oxygen, and monitor patient closely so you can watch that airway. Detergents, detergent suicide. Method of suicide started in Japan. It's becoming more common in the United States where people just drink detergent to kill themselves. Mix of two easily obtained chemicals to release toxic hydrogen sulfide and gas, commonly released inside enclosed space such as a car. So, that's where, you've heard those cases, right? Someone parks a car, closes the garage, leave it running, and kill themselves through breathing in that stuff. So, um, again, scene safety on that one. Exposure to fumes may injure EMS personnel, so get that, firemen en route, open up the garage door, let it clean out, but if the patient's alive, get them out of that place. But warning, note may be left on vehicle, or warning, note may be left on vehicle, but this is not assured, so may need to treat first as a hazmat scene. So we don't know, that's when you can't just determine, oh, it's a suicidal attempt. All that in the garage, all those chemicals and all those fumes, we don't know what's going on, so it becomes a hazmat scene where you get fire and everybody else involved. It can be absorbed through skin. As an absorbed poisons may or may not cause damage to skin. Patient may require decon prior to treatment. That's one of those things where, like when we had the active shooter here in Cheyenne County a while back, one of the things that EMS failed to do, and so did the hospital, is decon the patient because they threw all that gas in the house to get the guy out of the house, but he stayed in the house. So they threw an awful lot of gas. I can't remember how many containers into that house, and you could smell it in the ambulance even a day after that patient was in there. So the point being is, as soon as that guy was detained by the sheriff's department, we as EMS should have had fire help us decon that patient before putting him in the ambulance, and then hospital should have made sure he was decon before he went to the hospital. So we all overlooked that a little bit because it was just an intense day. But when it's a drug that can be absorbed, a gas, a chemical, whatever, we gotta think we probably have to decon this guy before he goes in and touches our stretcher, and we touch him with our hands and get everything in the ambulance, right? So, because if it's on the skin, it's going to transfer onto the BP cuff, it's going to transfer onto you, it's going to transfer onto the stretcher, it's going to be in the ambulance, and then it's going to be in the hospital. So, just something to think about. Patient assessment, what substance was involved? So, what did they inhale? When did exposure occur? Again, what's the timeline? How long were they exposed? And how long did they breathe it in? And over how long did the exposure occur? What interventions has anyone taken before we got to your EMS? And what effects is the patient experiencing? Same assessment, right? Use the sample, use the OPQRST. But the main thing is, again, what's the chemical? How was they exposed? How long were they exposed to it? And what effects are they having? And what was done to intervene before we got here? So, patient care. Assess for immediate life-threatening problems in primary assessment. So primary assessment, stop, take care of life threats. Perform a secondary assessment, get those vital signs for trends, and get the baseline. Remove powder by brushing off powder, irrigating with clean water for at least 20 minutes, and during transport. So get them moving. Depending how bad the exposure is, fire hose works good too for decon. But if it's not that bad, when you're en route, get your water. We got water. We can wash it out for on the way there and take care of them that way. But the first thing is you want to assess the primary assessment, take care of life threats, do the second assessment, get the baseline vital signs, and then begin transport and moving off all the chemical exposure. Transport with all containers, bottles, anything you can find that shows what they're exposed to, and reassess. Now, the injected poisons is illicit drugs. Um, Illicit drugs, most common are, illicit drugs and with needles and venom of snakes and insects. So, injected poisons are typically illegal drugs, and then also rattlesnake bites around here. I've seen a lot of those, um, more than I would expect, and plus different insects. Poison control centers are an excellent resource. Let me just back up for a second. So when it comes to venom, snakes, and all that kind of stuff, KMH typically carries antivenom. So the one thing I want to make clear is KMH, usually carries antivenom. So that is a place that we go, because one of the things that you want to look at when we get to the environmental chapter, environmental emergencies, we'll talk about spider bites and snake bites more on what we do as a assessment and treatment. But KMH carries antivenom, and then we also will splint the area. So if it's an arm that was bit or a leg that was bit, whatever it is, we'll splint it, and then we'll ACE wrap it to put a pressure bandage on it, to slow the poison from spreading to other parts of the body. But just an FYI on that. Um, Poison control centers are an excellent resource. Like I said, my partner on the um, chlorine poisoning, one of the first things he did is called poison control. Information on poison, signs and symptoms, and treatments. So my protocol for you is really any kind of poison call you go on. Call poison control and cover yourself and make sure you're doing the proper steps, and then follow our local protocol for contact procedures as well. So call poison control and communicate with KMH really is our protocol. Alcohol and substance abuse, as we start wrapping up this chapter. Um, Many patients whose conditions are caused either directly or indirectly by alcohol or substance abuse is a poison. It's counted as a poison. I remember being in high school. I was at a party, and I had a girl in our class that went into or had alcohol poisoning, and her pulse was actually her breathing actually stopped repeatedly at night or during this time, and went unconscious and came back conscious, but her breathing kept stopping. So we ended up taking her to the hospital, and sure enough, the doctor said if we waited even 45 minutes longer, she would probably have been dead, just because she drank too much and didn't do it responsibly either. I mean, she drank too much, which is irresponsible, but she wasn't eating and she was drinking and just a lot of bad stuff. So, abuse of alcohol and other drugs crosses all geographic and economic boundaries. Um, so, potent drug effects, central nervous system, can be addictive. Obviously, it is addictive, so that's kind of ridiculous that they said can be. It's addictive. Emergencies may result from recent consumption of years of abuse. So, the truth is, sometimes when we go on alcohol poisoning run or call, it's years leading up to that event. Sometimes it's just quick. Like that lady in class, it was actually a 3 day event because she didn't eat for 3 days because she was trying to lose weight for prom, and but then she drank all day that day at the party. So it was 3 days leading up to it, but it was that moment that was an emergency. We treat them like any other patient. Please do not be those people. Don't be someone on the team that begins judging someone who we're running on, even if it's a repeat call. Treat them with respect and treat them like any other patient. Abuse can lead to or worsen other medical conditions. So, diabetics that are drunk, bad deal. There's a lot of so when we get that history of the patient, we'll find out is this normal or abnormal, and is there other effects going on because the alcohol or drug can affect other health issues. Um, Alcohol often consumed with other drugs, which can result in a serious medical emergency. So, a stack effect, right? So, you go run on a teenager from a party, they've been drinking, but they're also been doing illegal drugs, or an adult, for that matter, around the county. It's not absent from here. Someone taking meth and drinking at the same time, it develops into emergency. And paired patients can be uncooperative or combative. Most times they are. Contact law enforcement if safety is concerned. So just use your judgment when you're en route to the call. And if you feel like, man, this sounds pretty rough, get a deputy there if they're not already there. So alcohol odor on breath or clothing, you definitely know what that smells like, and you're gonna smell it. You know when you go on a call, like okay, they're intoxicated, swaying or unsteady on feet, their slurred speech, rambling speech, flushed, complaining of being warm, um, nausea and vomiting, poor coordination, slowed reaction time. So one of the things that you want to look at with this too is, again, I've said this repeatedly, when you go on a call like this, blood sugar, blood sugar, blood sugar. One of the only ways you can determine between drinking and blood sugar really is a smell on the breath and clothing. Everything else can fit into a diabetic emergency as well. So, um, and then blurred vision, they're confused, hallucinations, visual or auditory. Um, I've had this before. I ran on a girl that was on meth, and she was hallucinating to the point where she was actually flying down the road when she got pulled over by a cop, and she actually tried to run the cop over. This is few years back. Tried to run the cop over, but she was hallucinating that people were after her, and she was such a real hallucination, and it was a visual and it was auditory. She could hear people and see people chasing her, that she was trying to outrun them in a car. Um, then lack of memory, so blackout, altered mental status. Um, so alcohol abuse, alcohol withdrawal, abrupt uh, seizing, you know, abrupt stopping of drinking may cause some alcoholics to suffer from delirium, tremors, which we call the DTs. You know, it happens quite a bit, um, and then can be serious. So it results in tremors, hallucinations, and seizures. So you can go out. You know, it's not just an overdose. Now what they're doing though, by quitting drinking like this for health purposes or whatever reason, is now they're taking the poison out of their body that their body is dependent on. So now they're causing another emergency, and it's just a bad deal. My dad was a raging alcoholic his whole life, and he tried a number of times to stop on his own, but he couldn't survive and handle the symptoms from not drinking. So it was just a catch-22 for him, and those people need medical attention. That's not something they should be doing on their own. Alcohol withdrawal. So again, they're confused. There's confusion, restlessness, unusual behavior, hallucinations, and gross tremor of hands. Um, a lot of times these guys will be profuse sweating. Uh, t- they can have seizures, typical, and they can be hypertensive because they're tachycardic. So again, it's just like anything else. When you take drugs out of your system, it's just like a prescription drug that you're on for a long period of time. There's always side effects when you go off of them. I have one prescription I take regularly. If I'm 3 days without it, or if I forget for 3 days, it really negatively affects me to the point of, I feel like I'm dying. So same with alcohol when you take it out of your system. So now you're gonna be tachycardic because your heart's trying to compensate for just going through withdrawal. You get hypertensive, um, and then you're gonna sweat a lot of times because you're tachycardic and hypertensive. It's like you're running a marathon, um, and then also it causes seizures, the depletion of alcohol in your system. Um, so when you're on that call and you're assessing, many medical conditions mimic alcohol intoxications, like I said, with diabetes, all that kind of stuff. So intoxicated patients may also have medical problems. Duh. I mean, it's just common sense there. And so you can't just, the alcohol is going to be the distracting symptom, but don't forget about other symptoms. And that's the main thing. You go on a trauma call, you see a bone sticking out of an arm because the arm's broken. You got the bone that pierced the skin. That can be distracting, but don't let it take away from the internal bleeding that you can't see, right? So, um, same with alcohol. Don't let that distract you from the other things that might be going on with the patient. All patients receive full assessment regardless of suspicion of intoxication. So, do not be those people that judge. When you go on a call, that patient, no matter how many times you've ran on them, they're the same. You treat them like every other patient. You respect them. You do a full assessment regardless of the distracting alcohol in your face. Um, because the simple fact is, it could take one time of judging and not doing a full assessment, and you miss something, that person dies, even though you ran on them a number of times. And I've seen that happen, not with me, and not in this county even, but I have seen that kind of situation take place. Um, when you're taking care of the patient, take proper precautions. BPE, BSI, PPE, you know, glasses, because there could be vomiting taking place. Um, keep suctioning ready because the vomiting and the aspirations. Stay alert for airway and respiratory problems. Depending on what they're overdosed on or how much alcohol they drank, eventually it can cause respiratory um, to slow down, and so you want to watch those things. Be alert for changes in mental status. Um, Monitor those vital signs. You want that baseline vital. Follow the trends on the way to the hospital. Right, you're gonna do a primary, you can do a secondary, and you're gonna do a third assessment. Treat them for shock, because essentially that's what is taking place. Gather history from patients and bystanders. Stay alert for seizures. Transport the patient to a medical facility, obviously. Um, so anyway, that's just the patient care, a little bit of things. And you guys will know that when you go on that call, you'll be able to take care of that. Substance abuse, any chemical substance from taken for other than therapeutic reasons. So um, obviously now marijuana is a big thing, CBD, all that kind of stuff. So a lot of hemp, a lot of that stuff's going around, and big thing is I've never once in my life ever judged, you know, marijuana. Even when I was in high school, it was illegal and it wasn't, But the fact matters, I know there's medical purposes for it, and I also know there's abuse for it, just like any other drug. So, um, but the substance abuse, it includes uppers and downers, narcotics, hallucinogens, and volatile chemicals. So it can be any one of those. Um, so the substances are off. You get the marijuana, you got the acid, you got the all kinds of stuff. So uppers are stimulants that affect the nervous system. So a lot of those are cocaine, amphetamines, maybe snorted, smoked, or injected. Um, and when you go on these calls, make sure to look around, especially for the sheriff's department. When you go on a call, whether the person's in their car, garage, house, yard, look around to see if you can find anything to show what they used for the drug, whether they smoked it, injected it, whatever. Because even not just for medical purposes, but also for the sheriff's department, if there is a visual thing that you see, it helps them be able to investigate the situation more. Uppers, signs and symptoms. They get their excitement, they're restless, they're anxious, they increase pulse rate, breathing rates, they're sweating, hyperthermia, no sleep for a long time, possible days. So they're going nuts. But the main thing is you want to look at is there's a lot of excitement, they're restless, so they're kind of anxious, their pulse rate's tachycardic, and their breathing rates up there. Um, and the funny thing is hyperthermia, because they're so up, it seems like everything would be the opposite of hyperthermia, but they actually can suffer from that. Downers, central nervous system depressants, barbiturates, um, roofies, gamma hydroxybitrates. Um, Signs and symptoms of this is they're sluggish, poor coordination, decreased pulse, and respirations, and eventually they can go down. I mean, it's the point where it stops. So when you watch these people, they're the ones that kind of just fall into a coma and quit breathing in the night and die. You hear these stories all the time. So uh, a lot of times these narcotics, they can be used for relieving pain or help with sleep. Opiates, heroin, codeine, morphine, oxycontin, oxycodone. So the problem with this is it's a hard deal, guys, because you're gonna be surprised sometimes when you go on a call who's addicted to opiates. But it's kind of a catch-22. We the doctors prescribe this stuff, which I can understand needing, but I know when I was a kid and I had my wisdom teeth taken out, they didn't give me oxycodone for pain. So take some ibuprofen, right? I mean, so it's just nowadays we're just handing this stuff out for every single little thing. And so you're gonna be surprised sometimes when you run on somebody and you're like, man, I would not expect that person to be addicted to opiates. But I think it's a pharmaceutical created problem. They prescribe it. You and the fact is oxycodone and codeine. These things you take for one time. You take it for your prescription, right? So give you this for 30 days. Well, in 30 days you're addicted. Now you're going through withdrawals and all kinds of problems to get off of it. So you're gonna be surprised at this stuff. And again, I'm just gonna repeat: keep your judgment away. Don't bring your judgment into the business, um, because some of these people, they really don't want to be addicted, but they are. So it's just kind of a it's just a problem that we've created anyway. So opiates, and oxycodone. Just don't be a person that brings judgment into the business. Narcotics, signs and symptoms. So reduced rate of pulse, rate of depth, um, of breathing. They're lethargic. I mean, these guys are really just lethargic. Their pupils are pinpoint because they're not reactive to your pin light at all, and they're eventually get into a coma with this. But the fact is when you try to talk to these folks, they don't make any sense. It's not slurred speech like alcohol. It's just a different kind of tone and everything because they're just kind of going out of it, and even their talk is lethargic. But without it being taken care of, eventually they're going to go in a coma. Um, Hallucinogenics creates intense state of excitement and distorted perception. LSD, PSP, XTC. So some things that you're going to see with these are rapid pulse, dilated pupils, flushed face, seeing or hearing things. Um, their distorted perception. I mean, all this is crazy. I've seen some guys that just have a whole alternative world around them. Nothing makes sense to them. I mean, it makes sense to them, but it doesn't make sense to us. Just a very strange ordeal. But, so we had a full-on alternative world that made sense to him, but not us. It was literally like a movie. He was in a movie like the Truman Show with Jim Carrey, and we couldn't communicate with him because he didn't see us; he saw somebody else. So their distorted perception can go pretty darn deep when they're overdosed on this stuff. And then a lot of times there's some volatile chemicals, produce vapors that are inhaled. Initial rush can act as central nervous system depressants, so the quick initial boom, and then your nervous system shuts down into a depressed state. Um, so some signs and symptoms of this would be dazed, disoriented, may develop a coma. May fall into that coma when because when there's that rush and then the nervous system crashes into a depressed state, it can shut everything down. Swollen membranes in nose or mouth, funny numb feeling, tingling, even inside the head, um, and changes in heart rhythm. So now their heart rhythm is no longer, um, in the cardiac chapter that we talked about, it's not even a VTach, it's not a VFib, it's just an abnormal murmur, abnormal rhythm. So, um, so with that situation, patients it may be difficult. Patient's level of consciousness, patients may have taken more than one type of drug. So there's more than one in their system, so it's kind of hard to gauge your assessment. Patient may be uncooperative or combative, and I've seen that with the guy who's hallucinating. I mean, he was throwing people twice his size around and very combative. Be aware of a possibility of contaminated needles and the presence of chemicals. So keep your scene safety in mind even throughout this whole process. Be scanning the room to try to see any of those things as well. Contaminated needles around or find chemicals laying around that can help you. Um, be aware of possible airway problems and respiratory distress. I mean, because it's that instant rush, right? But eventually, no matter, let's say you're catching them and they're in the upper state, eventually that's going to come down and it's going to go into respiratory distress. Provide oxygen and assist respirations as needed. Treat for shock. Um, um, and the thing is with I'm trying to back up for a second. I'm sorry, but even with the upper kind of situation, it's not really going to be an upper. I mean, they're probably going to be going into a depressed state pretty quickly. So you're probably going to be dealing with someone that's almost like a narcotic. But treat for shock. Talk to patients to keep them calm and cooperative. Perform physical exam. Look for evidence of injection sites, track marks. Here's one right here because it kind of shows the tracks of where they've been injecting and sometimes the pathway of the drug. Um, just a horrible deal, man. Horrible situations. So transport as soon as possible. Do not stay and play a whole lot. Consult with medical control according to local protocols. So, you when you're on these calls, you can call me. I'm not necessarily medical control, but I can talk to you about our protocols more. And at the same time, we call KMH and get a doctor on the line. Perform reassessment with monitoring vital signs. So watch those trends, and you're going to hear me say that for the duration of the class, and then your career with in the future is with you working with Lyman or Cheyenne County Ambulance. But baseline, and watch the trends of those vital signs. Continue to reassure the patient throughout all phases of care. Um, Dang, I wish this video would work. I'm sorry, I tried to get this to work. Um, but I'll look and see if I can find a video to recommend you guys. But you can see the toxins there, so that charcoal is coming through. And so just remember, activated charcoal is made from charred wood, and so all the toxins are banding to the surface of that charcoal, and it keeps it from absorbing into the body and transports it out of the body. So, some review. In a poisoned patient, perform a primary assessment, take care of those life threats, ensure the airway is patent, and administer a high concentration of oxygen. Perform a secondary assessment, including the baseline vitals. Find out if the poison was ingested, inhaled, absorbed, or injected. What route did it take to get into the body? What substance was it that was involved? How much poison was taken? And when or how long of a period? And what interventions did they try to do already? And what effects the patient experienced? So it's going to be important to understand what they did already. Um, Consult medical direction as directed. Administer activated charcoal, water, or milk for ingested poisons. Remove the patient. And remember, milk is primarily for one that we're not transporting. Remove the patient who has inhaled a poison from the environment and administer high concentration of oxygen. Remove poisons from the skin by brushing off or diluting it while you're en route. Transport the patient with all containers, bottles, and labels from the substance. Reassess patient en route and carefully document all information about poison interventions and patient responses. So, carefully document the information on the poison, your interventions, and the response to those interventions. Safe Safety is always first, so take care of yourself. When dealing with a poison substance abuse patient, poisons are generally classified by route of exposure, so effects vary greatly depending upon the type of poison and method. Um, and just remember, guys, EMTs must use thorough assessments, including seeing clues, to help identify the nature and severity of the poison. So you're a cop and an EMT at that situation. Poison Control Centers offer a wealth of resources, and when you guys all pass your tests, you will have numbers to them um, in the ambulance, and I prefer you to put them in your phone as well, so you just have them. Alcohol is commonly an underlying issue with patients. In some patients, it may be the most significant problem. The effects of substance abuse can vary greatly based on the type of substance determined the type of drug ingested. Can shed light on effects to come. So anyway, go through these questions. You know, what are potential risks to the responder on a poison or overdose call? Well, we can get poisoned. You know, we can inhale a toxin, we can inhale a gas, we can touch the patient and get transference of there if it's on the skin. What are the routes of entry into the body? You know, you swallow it, you breathe it, and you touch it. That's how I say it. I mean, it's not the book form, but that's good enough for me. What are some things EMS can do to prevent poisoning, especially in children? You know, watch your homes and train your community. Really get into schools and kind of train on prevention. So, anyhow, anyway, good to see you guys in this class. And anyway, um, hope this helps. Please communicate with me on how you're doing with the classes online. And I want to be very helpful to you guys. So appreciate it. Thanks.